Great. Can you put the thingy up? Okay, great. Hello, everyone. So I know most of you, but I will introduce myself. So my name's Kate Walsh. I am the newest member of the Omega team, the amazing Omega team. And I work here at the DuPont location. I joined in September after my second maternity leave. So having that postpartum process myself kind of prompted this topic. I had some low back pain as a new mom, especially with my first, and I felt like I did a better job with my second so that I didn't have the same problems that I did with Charlotte. So yeah, let's get rolling. So we're gonna address how to prevent it and get some tips and tricks. So a little bit about me, again, some of you know me, but this is my cute little family. So I am originally from Delaware. And this is my husband, Joe, and then my two girls, Charlotte and Maya. I went to UDPT and UD for undergrad. And since then, I've really had a focus in orthopedics. And I use dry needling all the time in that focus. So I really think that it's beneficial in identifying soft tissue restriction or activation issues. And I just think that it's amazing. So that's my little spiel for that. I think it's great. And then I treated in Delaware, Illinois. Oh, did you jump the gun there? My goodness. So I've treated all over the place. Delaware, Illinois, Hawaii, and Mass. And it was in Massachusetts that I really started to love spine. I kind of got thrust into this Celtics entertainment world. So it was all dance, dunk team. They all had some low back issue because they had terrible landing mechanics. And so I just ended up treating spine. Then I had Charlotte, and then I really started to hone in on spine. So that was kind of my transition into liking to treat spine. I feel like before that, it seemed like such a complex issue, so I started really looking more into it. So alas, here we go. Now we can go. Okay, so how common is it? So after you deliver your baby, now most of the articles that I looked at had a crazy variability in terms of percentages of moms that dealt with postpartum low back pain. On average, I would say 70% was the average that I found across the board, was consistent for moms acutely postpartum having low back pain. So that's the first couple of weeks, that first 6-week mark that they always give you, that 6-week benchmark for exercise. That first six weeks is the 70%. Then after about 3 months, they check back in, and it's around 25 to 40% of moms still deal with it. And then at the end of a year, 1 in 5 moms still is dealing with low back pain. And so why is that? So as we look at reasons we avoid treating it, our hormones are so fun. And so we have this insane push of estrogen and progesterone and relaxin and all the stuff that helps us carry the baby. And then after you deliver, they go wild. And so it's a piece that plays into the mental health side of things as well, that hormone regulation is necessary for finding motivation and engagement and activity and things like that. So that's a reason we avoid it. Lack of time, right? Now we're taking care of 1, 2, 3 children, right? So once you have all of those kids, you're like, well, I don't have any time for myself. And then there's the mom guilt and dad guilt, but mom guilt is worse. And so I just think that we feel like if we do take time for ourselves, like how dare we, right? Like we should be spending time with our kids. Like, you know, there's the stigma behind not spending time with your kids and focusing on yourself, that it's selfish in some way, and it is not. But that is some reasons that we avoid it. So just taking a quick look at anatomy. Obviously, it is way more complex than this. This is peeling back a lot of layers. But we have our thoracic and lumbar vertebrae. So you have 12 thoracic, 5 lumbar, that feed into your sacrum and your coccyx. And so that's kind of on the posterior side. Then you have your innominate bones that make up your pelvis. So you can kind of see one side of that up at the top there. And so those two pelvic bones, where they meet your sacrum, are your SI joints. And then where those two pelvic bones come and attach in the front, that's your pubic symphysis. So that especially is affected in pregnancy. That gets all loosey-goosey so our kid can come out, right? But you also have all these pelvic floor muscles that come forward. And if you look here, this is your coccyx here, that's your pubic symphysis. So you see all of these pelvic floor muscles, they're a sling, and they run from the back to the front there. And so you can imagine that those are key elements to pain in general postpartum, but how it feeds into the spine there, okay? And your hips, yeah. Okay, so what happens? What happens to us? Okay, so our spine. If you think of our spine as an S-shaped curve, we have an arch in our spine. We call that lordosis. But as our belly grows, our center of gravity shifts forward. And so if you notice, as you do that, you get an increase in the hinge of that low back. And so there's another component to that, that as that happens, we're also expanding in the belly itself. And that uterine expansion actually creates compression on that sciatic nerve. And so a lot of times pregnant women are complaining of sciatic pain, and people are treating the spine, but often we forget that we also have this visceral part of our body that is expanding as well and creating compression. Our pelvis, so those two bones creating that SI joint, it widens. It has to in order for the baby to fit. And as that happens, you get SI compression in the back. And oftentimes this is asymmetrical, so people will feel one side more than the other. Part of that is due to the anatomy of how that uterus is sitting, and part of it is just due to repetitive postures you do during the day. Like, do we always sit like this? Do we always lean this way on the couch? You know what I mean? Like, that plays into it. Cody's like, yes. The other piece that is important, and that I read a bunch of articles about and seems pretty consistent, is that sacrum and coccyx. So as our spine comes down, it curves this way, but then it tucks under this way. And that's important because our spine is like a spring. But when we are pregnant, and especially post at least vaginal delivery, that coccyx will flatten. And it has a very hard time returning to its normal position. They said the large majority of moms post-vaginal delivery do not get back to their normal curvature at all. You always will have a little bit of a flattening there. So we'll go into how to combat that a little bit, but you're gonna have a little bit of it if you deliver vaginally. And then pelvic floor, obviously that stretches as everything kind of expands, and then hips, we become a little more sedentary as we get a little bigger. And so the hip flexors become very, very tight. They're basically searching for any type, your body is searching for any type of support that it can get that's not ligamentous, because those ligaments have relaxin and they are stretchy, stretchy. So your muscles become crazy toned to try to provide some infrastructure to your body. Okay. And your glutes get weak. Okay, so this is just kind of a visual of what we just talked about. As you can see in that top left corner, that's a normal spine with a little baby. And then as it expands, you can see how the glutes push back, you get an increase in curvature, and that center of gravity shifts forward. Below is pelvic floor. So the pink is the muscle sling that runs from front to back. And so if you see how the bladder, the uterus, the rectum, they dive through those muscles, there's a constriction there, right? So they assist in control with all of those organs. However, when you have this expansion, you get a weakening of the pelvic floor because it gets overstretched. And then you can see that the compression, especially on that bladder, becomes, very, very minimal. And so that's why we pee all the time. And then you have your uterus, which that eventually goes back, but usually the bladder lingers a little bit longer. The rectum, as you can see, it actually expands a little bit at the base, which leads to like constipation and stuff like that. But that can also play into back pain. So that's a referral pattern for back pain. And then these two are just pictures of normal hips and SI, but I wanted to show especially SI here because look at how many ligaments there are. So all of that in a healthy body provides your structure. And when you add relaxin, you can imagine that all of that starts to move. All of that becomes unstable. And so that can create a real big problem. So all the more reason that strength training in pregnant women has had such a push, because those muscles can kind of mask that and keep that stable until that relaxin kind of regulates post-delivery. What about our core? It goes away. Okay, so the core muscles, obviously they stretch, right? So we have this growing baby, they get all stretched out. And so our pelvic floor coordinates with our core muscles. And so once that core, this is also kind of like during pregnancy and post-delivery, that pelvic floor, once it is weakened, it now no longer coordinates with that core, and vice versa. When that core stretches, it has a hard time coordinating with the pelvic floor. And so that, combined with lack of activity, can lead to slower recovery rates postpartum, and obviously diastasis recti. I didn't personally deal with this, but I know a lot of friends of mine that have, where when we don't do some prenatal core work, it just allows for an overstretching of that tissue and a separation of that rectus abdominis. Okay, so postpartum, why does our back hurt? So oftentimes, and we talked about this a little bit, we're stuck in an open birth pattern. So our pelvis stays widened, that sacrum coccyx complex stays straight. And so, like I said, that leads to poor regulation of force in our spine when we don't have that S-shaped curvature to help us. For people that have C-sections. So C-sections, I know they happen all the time, but it's a crazy surgery. And so after they sew you up, you get all healed, you get this pretty intense scar, and scar mobilization is crucial once you're cleared by your OB to not only assist in just the mobility of your abdomen, but in low back pain. And that's because you have this ligament that connects your uterus to your sacrum. And so if you have poor scar mobility of the C-section scar that is correlated to that uterus, you can imagine that then connection to the sacrum will result in reduced sacral mobility, hence leading to low back pain. Okay. We talked about the pelvic floor and the core weakness, poor coordination, and then postural demands. We now have to stay like this when we change a baby. We have to put them in a crib. We have to constantly be on the floor. And floor play oftentimes is a big issue for our moms because we're not playing on our belly. We're sitting and we're flexing. And that then leads to increased strain on the spine. Also in anyone, not just postpartum moms, any combined flexion and rotation for your spine is a big no-no. And so doing that and then trying to lift a baby, you're gonna end up with some strain. And breastfeeding. I know personally, I put myself in weird positions when Charlotte was born. You're kind of curled up, you're just trying to find any position that they'll just stay still and feed. And so that too can lead to issues with the back. And this is just kind of a breakdown of all those. I know it's in a pie chart, but I honestly think it should be a Venn diagram. They all kind of go together. Okay, and we cannot forget about mental health. So addressing the psychosocial factors, so postpartum depression, stress, anxiety, all of this stuff plays a role in how you perceive pain neurologically. That signal to your brain of what you're feeling is heightened whenever you have things like stress and anxiety playing a role. And so that can also influence your recovery as well. When you feel anxiety or depression, you kind of pull back, right? You don't want to participate. You avoid certain things because out of fear, whether it's fear of pain or whatever fear is being correlated to your stress and anxiety, you pull back. So there's reduced engagement in terms of your healthy lifestyle choices and things like that. There's also role strain and identity, especially in first-time moms, because you go from a life where you are in charge of yourself to now you are taking care of this human being. And so there's this feeling of being overly burdened that A, leads you to think like, well, I shouldn't take care of myself, I should take care of the kid. And then you also have this like, well, who am I now? And so that stress then ties back into pain perception. So it all kind of loops through. Okay. And so diagnosis-wise, like how do we diagnose postpartum low back pain? Hi. So you talk with your OB first. So anytime you're postpartum and you need to figure out what the pain is, talk it through with them first, especially if it's within that first 6 weeks. And it may require a multidisciplinary approach, but more often than not, the OB is going to give you guidance. They're gonna give you stretches, exercises that may work, but it's a very personalized thing, your pain. It's very different from person to person. And so then they will send you most likely to us. And usually we can take care of it. And so PT manually assesses what your issue is. We can feel around, where are you tight? Where is your range of motion lacking? How do you perform this? What are you compensating with? And so we have a good view on how you're functioning. Whereas when you go see your OB, they see you for a short period of time. So they don't necessarily get the full picture. Now, if we do PT for 4 or 6 weeks and we're not making any progress, then we would maybe refer you to an orthopedist to take a deeper look, maybe get some imaging done to see if we're missing anything. But more often than not, PT is kind of where the best option is for postpartum low back pain. So a treatment strategy approach that I think works in general, but especially for postpartum, is this 3-tiered, here's my Venn diagram, strengthen, relax, and reinforce. So you want to make sure that we are strengthening the pelvic floor and the core and posterior chain, because once we get into motherhood, we do a lot of this, and this goes to sleep. And so we need to make sure that we wake those muscles back up. We then need to relax our hip flexors, and we need to also relax our neck and shoulders, because again, breastfeeding, lifts, things like that, we always end up like this, and so we need to chill out. And then reinforcing what we're trying to do with ergonomic changes, so like where is the changing table, what height is the crib, those types of things, or how you hold your baby when you feed are very important. And just like increasing your awareness of what proper posture is can be super advantageous, because no matter how much I stretch your hip flexors, if you keep sitting, they will continue to be tight, right? Okay. So these are some modifications, or actually just recommendations for proper lifting techniques, positioning when you have the baby. So baby carriers, if you think of it like a backpack, but on the front, right? When we were in middle school, it was cool to wear it at your butt, but that was terrible for your back. And so the same thing is true for the baby. The baby needs to be up, so head is on chest and close to the body. So the difference between those two pictures is the strap in the middle. Oftentimes moms think pulling that bottom strap is what's gonna provide the low back support, but it's not. It's that middle one that pulls the baby close to your body, and that gives you the greatest advantage so that you're not constantly feeling like you have to arch back and hold that baby up. Speaking of that, when you carry the baby, making sure that we don't rest on our ligaments in the front of our hips. So oftentimes we rest back here, our glutes go to sleep, and we start to have back pain. And so trying to create a little bit of a posterior pelvic tilt, so squeezing those glutes, engaging your core, and then holding the baby under their butt, not behind their back. Because as soon as you do this, if you think about the force that your arm is providing, it's this, and so you're naturally gonna wanna push back. And so holding under the bum is a much better position. Breastfeeding, the one on the right is how I started with Charlotte. You just kind of curl back, your feet are out. But the best way is find a supported chair, use a pillow so that the baby's in the right position so you don't feel like you have to lift them the whole time, and then putting a stool under your feet so that you feel like you're rooted in the ground. And then the last one is lifting from the floor. So I feel like this is often where you see the greatest variation in how people get their baby off the floor. But the best option is going into a staggered stance, going to the ground, pulling the baby in first, and then standing up. Oftentimes we either squat or we try to go down to the floor, but we stand up with the baby and then bring it close. Oh, the mic. But the key is go to the floor, pull the baby in, and then lift up. So anytime you have a load of force, you want that closer to the body before you move, okay? Okay, so then these are some key stretches that we should do as a kind of like postpartum focus based on what is usually tight. And we talked about this a little bit, right? Like stretching the neck. So upper trap stretch, that's the muscle here. That's the one that shrugs our shoulder. So that's a great one. Usually for these, most of them are 3 sets of 30 seconds. They're usually sufficient to give you enough length. Pec stretch from breastfeeding, right? Opening ourselves back up, getting ourselves either in a doorway or in the corner of a room. Usually that can provide sufficient relief of tension there. QL stretch, same thing. When you're sitting breastfeeding, oftentimes that QL is the muscle that runs from basically the bottom of your ribs out to the outside of your pelvis, and it's a hip hiker. But it also helps us to side bend whenever we're getting into these kind of odd postures, so that's always a nice one to stretch. We talked about hip flexors, and then piriformis is basically that muscle that runs along from our sacrum to our femur, but when it's tight, it compresses on our sciatic nerve. And so if we're having back pain, sometimes we should check into that muscle because it could be compressing on our nerves. And then when your baby's in tummy time, you're in tummy time. Because that is something that I think us as people, not just moms, just humans, we lack tummy time anymore, right? And so it is essentially the most crucial thing postpartum is getting yourself into just a little bit of extension. Because for the last probably 3 months of your pregnancy, there's no way you were even in that position. So it's been a long time. And then core strength is a progression postpartum. So acutely, you want to focus on breathing techniques, re-engaging your diaphragm as it's part of your core, and then working on pelvic floor, because we talked about how that core coordinates with the pelvic floor, and just reteaching how to engage your core, because you'll notice like immediately postpartum, you're like, well, how do I even get that to kick on? Like it's overstretched, and we need it to, you know, wake up slowly. Intermediate, so acute you can do usually pre that 6-week appointment. Obviously you should get guidance from your OB, but acutely you can usually do these in that first 6 weeks. Intermediate, you should probably wait until you get clearance from OB to do. So functional core training, modified lifting techniques, so working on some squats with maybe a little bit of weight, and plank progressions. You can start doing maybe a little bit of a modified plank. And then advanced is like getting back into your bar class, your Pilates class, that kind of a thing, higher velocity movements. So these are some examples. So acute, again, was breathing, pelvic floor engagement. So we have on the left there, diaphragmatic breathing, breathing into your hand. And I can give you guys, if you want examples of these, I can just send this to you in a PDF that actually like deeply explains what each of these is. The one that's on the right in the acute side, that's a brace. So you're working on engaging your core, but in a different position. Oftentimes we always focus on core on our back, but being able to get into that quadruped position then allows for an easier transition into planks. And so doing it in that position might be a little bit better. And then a ball squeeze is great to help with a pelvic floor contraction with a little bit of adduction. That adductor attaches right to that pubic symphysis, and so it's a great one. Intermediate, you can start doing asymmetrical movements. So that's a bridge with a little bit of march, side plank with a little bit of a leg lift. So focusing on maintaining stability on one side with the opposite limb moving. That helps to coordinate a little bit of SI stability and core engagement. And then obviously working back into more functional movements like squats, lunges, things like that. And then advanced can be whatever you want it to be, but I thought these were fun. So this is a dead bug pushing into the wall. Getting a little bit of arm extension helps to really engage the whole core. Plank progression to hip dips, whatever you want it to be, and then a little bit of stability, so a little bit of balance, working with some pulling of the resistance band, but again, it can be whatever you want. Okay, so why PT? Okay. So it's personalized care, like I said. Like we take a look at you, and everything that I give to Brianna will be different than I give to Emily. So I think that it's super important that we have that identified early, because I think your recovery will be faster if you have that type of approach. It's non-invasive, so there's no injections. Needling you can call invasive, but I don't think it's invasive, right? Doug's like, no, it's not. Uh, and then emotional support, like you can come and chat. Like most of the time, Cody can tell you, I talk a lot. But yeah, but you can come and chat. And so, sometimes just getting out of the house and being able to just talk to another adult sometimes is so healing in general. And when you tie in that mental health component, like it can really help. And then empowering you through knowledge, like oftentimes people are like, why is this happening to me? But once you have an understanding of like what is occurring, you feel empowered and you feel like there's a light at the end of the tunnel. So in conjunction with PT, there are other things that could be helpful. So pelvic floor PT, chiro, and massage therapy. So all of these can be beneficial. Pelvic floor if you're having like incontinence issues, chiropractic if we're feeling like your postural alignment needs a little bit more work. And massage therapy helps with muscle relaxation, hormone regulation. Like I said, those hormones are crazy, but those are all advantageous to use in conjunction with PT. And these are some people that are good at it. So Neely is part of our amazing Omega team. She's a wizard. And then Dr. Jennifer Briggs and Ann Collins, is it Deutsch or Dutch? Duke, okay. And so they both are in Independence Mall, right over by the Melting Pot. And then Karen Feeney, I think, is on Philadelphia Pike. Yes. Yep. And so what it bubbles down to is identifying where your source is coming from, what role psychosocial factors are playing, treatment, like how are we gonna do it? Do we need just PT? Do we need other avenues? And then patience. As moms, we have to be patient, and not just with our children, but with ourselves. Okay, that's it. And so if you would like to schedule an appointment, so for coming tonight, you can have a 20% discount on that first visit. So if you're interested, just let us know before you leave. But yeah, thank you guys for coming. Any questions? I feel like that was like a lot, but go to my any questions slide. It's very pretty. Yeah. I like it. Any questions?
Not an immediate question.
Yes.
So much of what you said, Kate, resonated. So I had suffered a lower back injury many years ago as a college athlete, and so with the imminent, as pregnancy started to grow, I was so worried that my back was going to hurt and
Sure.
I was going to have less pain. And what worked, or what I thought worked then as a kid,
Yeah.
wasn't working.
Right.
Now, and so it was the to your point, the empowerment of like knowing to try different things, but
Right.
purposeful.
Totally.
And so
Totally.
I didn't.
Right.
Still like just trying to stretch my hamstrings.
Yeah, exactly.
Belly,
Yeah.
so.
I think that's so true, and I think there's like just a lack of, and I found this when I was deeper diving into this, was there really is a lack of like true knowledge and true research, because there's so many hurdles that they go through to do research on pregnant people. And so, it's kind of like anecdotal in terms of what's available, but I think it's really coming along, and I truly believe that, getting someone to manually assess you is so beneficial, because people will spout out whatever they think is right, and until you take a look and you're like, no, your hamstring's actually fine. Like, let's take a look at something else. Right, right. And the other thing too, right, when you're stretching, when you're pregnant, like relaxin's there, you're already loose, right? So most often there's another problem that is getting missed, and so that, again, that's my other push for PT. Like, I just think that we can just see it better, And being a mom, I just feel like, I feel you. I had that. Yeah. Anything else?
Obviously not a mother, but in terms of pre-partum,
Yes.
actually what you refer to it as.
Like prenatal?
Yes.
Like while you're pregnant?
While you're pregnant.
Got it, okay.
Trying to engage your core and doing all of the exercises that you mentioned, trying to do things before
Totally.
you have your baby.
Yeah.
How do you know where to push your limit to?
That's a good question.
In terms of the exercises that you're doing.
Yeah.
Both like types of exercises and like if you're using weight or something.
Yeah, and I think it's totally variable, right? There are pregnant ladies that run marathons. So like I wouldn't recommend that for everyone, but I think that there are people that can push the limit, and I think again, getting somebody to take a look. How are you lifting, right? How is your control? Like, if you come in for like one visit and we're like, okay, let me just see how you're squatting. What is, like, if someone's having back pain, then we can address like where your level is and give you progressions back to like where you want to be. But I think like they say when you're pregnant, whatever you did prior to being pregnant, you can keep doing while you're pregnant as long as your OB hasn't given you guidance to stop. And so as long as you aren't feeling pain, you can continue to do whatever, run marathons as much as you want, as long as it's not then creating a dysfunction. And so it's so variable for someone, but really use pain as your guide, and that usually tells you what you can and can't do. But I mean, pregnant ladies can do a lot. Yeah, there are pregnant ladies that box jump, pregnant ladies that, you know, like I said, run marathons. So it's totally, totally variable. Sorry, that's not like a very specific answer, but.
A lot of it has to do with what you're used to doing before.
Totally, exactly, right, right.
If you're running
Your body's conditioned to it,
75 miles a week,
right.
Running 30
Yeah.
miles a week is fine, and you
Right.
run a marathon.
Right. I think it really boils down to like when you get to that third trimester, when you really have that center of mass pushed forward, like what does your squat look like? Like, yes, you can squat, but like, are we creating an issue here? But leading up to that, usually you can do everything. Yeah, as long as you feel fine. Yeah.
How long does postpartum technically last? I guess that.
In terms of,
So obviously, like postpartum, your postpartum visit is 6 weeks.
yes.
But, you know, it does go beyond.
Totally. What I've seen, right, that's a great question, right? Right. What does the insurance company tell us? So what I saw, and so obviously I'm not an OB, but when we're talking like treating the postpartum mom, usually it's within the first year of having your baby. That's what a lot of the articles focused on, was like, what is the back pain at 3, 6, 9, and 12 months? And then post that, they just call it chronic postpartum low back pain. And you're like, okay, great. And so, so if it lasts beyond that, obviously, then it just becomes more of like you have a back problem, not you have a postpartum back problem. But yeah, I would say like a year is usually where they cap it off. Because hormone regulation, they said, I think they base it off of where the hormones drop off, and they said that sometimes relaxin can take up to 6 months to get out of your system, which is crazy. And so you can feel a little bit off with what you're doing for that first 6 months postpartum. And so I think that 6 months is hormonally where like they usually say your hormones are back to normal, but I would say like orthopedically, you may want to give it like a year. Yeah. Mm-hmm. Yeah. Anything else? Good? Cody? Well, thank you guys for coming. Yeah. Thanks, guys. Yeah.